I'm Brielle Ocampo. I am 23 years old and I am now studying in the University of the Philippines, Diliman. I learned about the CSA Medical Aesthetics through my tita because she is a very good friend of Dr. Contessa, and she told me that there is a very nice clinic here and I wanted to try it. As you can see, I have a very small and cute nose, and there's nothing wrong with that. But I want to try enhancing it also to boost my self-confidence. Don't forget to click the subscribe button and turn on the notification bell to keep you updated.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a beautiful young guest. Let's all welcome Miss Brielle Ocampo.
Hello.
Hi, Brielle. She's so young. I thought she was just 16 years old or a high school student, but she told me she's already 23, okay? And a while ago, I did an assessment on her. Of course, she's still young, experiences some acne or pimple on the forehead and on the nose region, T-zone area, okay? But that's not our topic. Our talk will be more of an enhancement, especially in the middle part of the face, the beautiful nose of Brielle. I was telling her she already has this good nose, okay? But like, you know, we have measurements in the nose area. We have angles, we have rotations, ratios, proportions. Somehow, we still want to achieve those right, like, measurements, those right parameters, those, like, the right angles, like frontonasal, nasolabial, and we also wanted to narrow the sides of the nose and make the tip less round. Okay? Because I think that's her major concern.
Yes.
Parang very round yung tip, right? And frontal view, kind of a bit wide. You think? A bit wide, and this tip is kind of like, do you say bulbous tip? A bit of that, okay? But she already has a beautiful nose. This is like a treatment whereby we give this to individuals who still wanted to get that well-defined nose, well-contoured nose, okay? And something that will still be proportioned to the face, okay? Dapat balance lang sa face mo, right? Because she has a beautiful face already. I love the shape. She's still like a baby. We have that round shape. Asians, we have this round shape face. And of course, our nose is kind of round also. Just balancing with the shape of our face, okay? But if we want to still kind of enhance it, we can still do it non-surgically. She doesn't need any surgical procedure on her. We'll just do something that's more natural, and it is still her, okay? We'll show the procedure when CSA Medical Aesthetics returns. And we're back, so we're doing nose enhancement for Brielle, okay? So for our procedure, we start with numbing the entry point. The entry point will be at the infront tip, like 5 mm inferior to your tip defining point. This is just a lidocaine. We'll numb the entry point, and then after that, we'll be using our introducer needle, which is a gauge 19. And then this one will make a tiny puncture. And I'll be also injecting with hyaluronic filler to kind of give also like a volume. So I'll glide it in the layer 4, so-called supraperiosteal and supraperichondrial layer. So some pressure there. Make sure you're midline in the layer 4. And when you reach the radix part, that's the end point. And this is a cannula. So we just glide a bit and infuse a small amount of our hyaluronic substance. So this is also a hyaluronic that contains lidocaine, so at the same time you're numbing the bridge area. And then after the bridge, we can already go to the tip columella. We wanted to do tip columella projection So your goal is to reach the anterior nasal spine. We have a so-called intercrural space. Once you reach the anterior nasal spine, you can infuse your 0.2 ml of your hyaluronic substance. So again, this has lidocaine, so it's gonna help in numbing the treatment area. Okay, Bill?
Okay.
Yeah, good. So anterior nasal spine, infuse it with just 0.2 or even up to 0.3. Okay, almost. So we'll proceed with our PDO nose thread here. So I have my entry point, and then again the same layer 4, supraperichondrial, supraperiosteal, up to the radix area. That's one. And then we'll proceed to the second PDO. Okay, so it's a midline target area, and we are applying or inserting our PDO thread here. These kinds of PDO threads are absorbable. They will stimulate collagen formation and help in the connective tissue matrix regeneration. So these are already part of our regenerative treatment, and actually it's also used right now for anti-aging. So we're done with the bridge. We'll proceed with the tip columella projection. There are cases that I use the same entry point, but if they have that short columella, I make a second entry point just to make sure that the threads will be inside our intercrural space. I'll be using shorter PDO thread here. I'll grasp the columella and insert in that space there. So ideally, the nasolabial angle should be within the 90 to 105 degrees. For women, we want it 95 to 105. For men, we want it 90 to 100 degrees. So we've done the combination dermal filler and PDO threads for nose enhancement. We'll show the result when CSA Medical Aesthetics returns. And we're back, so we'll show the result to Brielle. Brielle, here is the mirror. You can now see the result of our nose enhancement, the non-surgical way, using our dermal filler plus those nose PDO threads. Comment, Brielle.
So beautiful.
I know, right? I really like your nose right now. Okay. So we did the enhancement in a way that we followed the nasofrontal angle here, the so-called fronto-nasal angle, about 115 to 130 degree angle. And then also the nasolabial, we want it like around 95 to 105 degrees. And then we have the so-called dorsal aesthetic line. We want it parallel. The dorsal aesthetic line is like when we do nose line in our makeups. Okay, so we want it balanced left and right. Okay, and so for the ulnar width, I was doing a measurement a while ago, so it's within that intercanthal width. So somehow we want this narrower. And then when you look at your basal view, this part here, okay, you'll notice like it's projected already. So it was initially, the shape is what we call, there are three types actually. We have the leptorhine, mesorhine, platyrhine. So we want to achieve the, of course, the leptorhine. Okay, those are like the Caucasian projected type of nose. Okay. The others were asking me, like for example, if you do a tip columella projection, will it affect the smile or will it affect the length of the upper lip? So you can you smile? Yeah, she still has that beautiful smile, so it didn't lengthen the upper lip area and it didn't affect the muscle movement, the orbicularis oris muscle area. Still good, right? It's normal to feel some heaviness or some pressure, or like there's something like, especially the tip columella, we use PDO threads. It's on top of the anterior nasal spine or a part of your maxilla bone. You feel the tip of the thread in your upper gum area. Do you feel it or not really? Yeah, that's normal and it's temporary. It's like for those who had braces, they know the feeling that there is discomfort there. It's same thing here, like you put a brace in the tip columella. It's just a temporary discomfort and it's gonna go away because the threads and those materials that we injected inside, they will actually integrate, they will blend in with the tissues of the nose. Thank you, Brielle.
Thank you po.
Yeah. Was it painful?
No,
Not
at
really,
all.
right? Not at all. And then the feeling right now is just say like a heaviness, pressure. That's normal. It's gonna go away. You'll just do ice compress. We can actually give prophylaxis antibiotics, okay? And then just rest for a bit. Like tomorrow, you can go to your usual activities, but not so strenuous activities, okay? And then you're good. So we just wanna also treat her like, you know, the comedonal acne. Okay, she's still young, so it could be hormonal or it could be like, sometimes it's like the activity of your sebaceous glands, and it could be triggered by factors apart from hormonal, lifestyle, diet, or genetics. Okay, but you're still young. That's why you still have active sebaceous glands. Okay, we'll also treat the comedones. We want to have clear, pimple-free, comedone-free skin. There you go. Like any message to the televiewers?
It's so beautiful. I'm speechless. But if you want to get your nose done or anything to enhance your face, just go to CSA.
Thank you, Belle. Yeah. It's no longer the short nose or the wide nose, right? It's kind of a bit elongated and it's elevated, okay? So we have improved it. So we followed those measurements, and at the same time, your face it looked narrower and slimmer. Okay? Pero pwede palang pampapayat ng mukha. Tsaka mas beautiful smile. Plus your eyes. They're like more beautiful also. I love her eyes. Okay. Thank you so much, Belle.
Thank you po.
Hope to see you again. And if you have any questions, you may email us at csaskinclinic@yahoo.com. Our clinic is located here at the Infinity Shop, Pulong Marugol, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. We have also our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Well, meron ka bang Instagram or any account that they could follow you and check on your journey of your nose enhancement?
You can follow me in Instagram and TikTok at Brielle S. Ocampo.
Oh, there you go. Thank you so much. Thank you, Belle. So, God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.